think one thing that makes VA patients different, a lot of them have some comorbid issues associated with their military service, things like what's called post-traumatic stress disorder. That can make them more sensitive to sleeping in a different environment. A number of our patients that have both post-traumatic stress disorder and sleep disordered breathing, then being in a novel environment like a sleep lab can pose some particular challenges in terms of evaluating their sleep problem. Some of the other home studies are rather challenging in terms of what's expected for a patient to apply the instrumentation themselves, and that can be a big issue, especially with elderly patients or patients that may have cognitive impairment. But the WatchPAT is real simple, and that makes it easily explained to and accepted by patients. Of course, it's very unobtrusive, so we found it very helpful for patients that are particularly sensitive to their sleep changing in a novel environment because of anxiety and issues related to that. They're much more comfortable taking the device home because it's unobtrusive. And my front staff, both the administrative staff as well as the technical people, is equipment failure. That's a big problem. And our failure rate with this device has been very low. There have been very few studies that have had to be repeated because of technical failures. I was pleased to see that the apnea-hypopnea index correlated very well with what I was observing on the conventional PSG, but I was even more surprised to see that the estimation of REM sleep approximated what we were getting in conventional PSG, because that seems even more unbelievable at first glance. But in fact, the PAT signal is telling us something about not just sleep disordered breathing, but sleep itself. And that puts it in a different class than many of the other ambulatory sleep technologies.